Good evening and welcome to Instagram Live. You're tuning in to COVID Chats. This is a speaker series that's been created by the Goldfarb Center for Public Affairs at Colby College in Maine. My name is Kimberly Flowers, and I'm the very new Executive Director of the Goldfarb Center, and I will be your host for this evening. So we launched this last week by talking to Senator Angus King on Monday and then Senator Susan Collins on Wednesday, looking at this from a congressional perspective. And then we turned to the state perspective last night when we spoke to Henry Beck, who's the state treasurer for Maine, as well as a Colby alum. We're continuing that this evening as we speak with another Colby alum, Representative Matt Ritter, who represents Connecticut on their state legislature in the General Assembly. So we've talked about a lot of different things on this series, from the issue of testing to the protests that were happening outside of the Maine governor's office, to racial inequality issues, to budget crisis, and as well, of course, the federal response. We were thrilled to see that a quote, as well as our Instagram series, was mentioned in an AP article today that had a quote from our talk with Susan Collins that went all the way up to the New York Times and Seattle Times. So we're thrilled that people are joining us and reading and watching that. And although, the idea for this originally was to connect Colby College students to policymakers in real time, to talk about the role of government leaders and public policy in this pandemic response. But we're thrilled that we've had Colby alumni, Colby faculty, the larger Colby community, as well as whether it's Waterville, Maine, or now it might be Connecticut, since we're focusing on Connecticut tonight. We welcome all of you. And I would say, please, down below on the comments at the bottom, let us know who you are, who's here, who's watching, who's joining, and feel free to add in your own comments and questions that we have for this evening. So I think, like many of you, I've been sort of obsessed with the news, right, following all of this. And, today is a milestone that I have to mention. The U.S. has now, hit 1 million known COVID-19 cases. But there's this one particular fact that I read today that's just really stuck with me. And that's that more people are on global lockdown than were alive in World War II. And that is just, I just sort of I can't keep fathoming that. I know for most of us, we're on like week 7 of stay at home. And, there's moments of anxiety with this, but we're so pleased that we can use an opportunity like this to think about what's the role of policymakers. We're so thankful for, of course, the healthcare frontline workers, but I would also say that policymakers are having to make some really difficult decisions with limited information that, quite frankly, are life and death policy decisions and that are really hard. And that's part of why we're having this conversation tonight. It's very clear that, there's a role for, of course, the federal government, but there's a huge role in this for state and local leaders. And that's precisely why we have these great leaders that have joined this series, like last night with Henry Beck and like tonight with Representative Matt Ritter. So let's turn to him. So Representative Matt Ritter is a 2004 Colby alum. He was a government major, like many of the students who are engaged with the Goldfarb Center. He's from Hartford, Connecticut, and he's a member of the Connecticut State Legislature. He's actually on his second term as the House Majority Leader, so he has a very big role to play. His public service career, it began much the way that Henry Beck's that we talked about last night, was that he began his career as a public servant on the Hartford City Council. He did that just after he graduated from the University of Connecticut of Law in 2007, and he's still a practicing attorney specializing in public finance and election law. I'm sure even though he's an attorney, he's probably spending a lot of his time and energy right now, again, on the front line as a policymaker, helping the state of Connecticut. So we are going to have him join us right now on the screen. Hi, there you are. How are you?
Good. How are you? We made
Great.
it work.
It's good to see you.
Nice to
So
see you.
tell us, as you think about this, what is the most pressing priority for you right now as a policymaker?
Well, we're trying to figure out how to keep people safe and reopen the economy at the same time here in Connecticut. And I can tell you that I thought the hardest thing to do would be to shut the state down and close businesses and close schools. I think we're finding the hardest thing is how to reopen. We have a reentry task force. We have dozens of legislators working on it. And you're talking about everything from a mom and pop restaurant to summer camps to doctor's office for consideration you have to give to reopen the economy is something that I don't think any policymaker ever really thought we'd have to deal with. And so you rely on public health experts and others. And we're trying to ramp up testing. Connecticut right now, we're doing about 4,000 a week if we're lucky. Average is closer to 3,000. We probably have to triple that by the end of May.
And how are you going to do that? I mean, the what we've seen, of course, of the federal response in terms of testing is bleak, to say the least. So what are some of the things that you're trying to do in place to get the testing up to speed?
So we're lucky, right? We're the home of Aetna, which is merged recently with CVS. And CVS has these Abbott rapid tests, which you might have read about or seen on the world news, which can give you 15-minute responses. We have a rapid testing site in New Haven. We hope to have another one open at some time in Hartford, which I represent. So that combination of sort of relationships because of where we're centered, coupled with just the exponential growth in testing at the federal level, I think puts us in a better position in the coming weeks. We're a smaller state, so that does help. We don't have the capacity that New York needs. So I think we're very confident that by Memorial Day in Connecticut, we will be testing at the right rate to reopen slowly, not all at once, but turning those valves very slowly.
And as you make these decisions, who are you listening to? Meaning, you know, I know there's the Reopen Connecticut Advisory Group that meets with, which I think the General Assembly every week. But are you speaking to other, other policymakers in other states? Like, who are you listening to, and what are the data points, and where are you going to get your information?
Yeah, it's a great question. I am trying to listen to scientists as much as I can. So you mentioned the Reopen group. There's a leading epidemiologist on that from Yale. I've got another call with the Yale doctors today, maybe too much Yale for one day. But we're also not ignoring businesses because, look, it's to give people some parameters under which they can operate.
You froze, but I think you're going to come back.
I'm back.
Okay, there we go.
And we want to have people, so we're trying to balance that. But I mean, look, we're on calls all the time. We're listening to different associations. You have the Restaurant Association offering ways they think they can open. You have the mall operators, right? So everybody's got an interest group. They may have a lobbyist. They may have a sort of a leading spokesperson for the industry. And we're trying to do that as best as possible.
Right. So, I see a question below from Sandy Maisel. You may recognize that name. And Sandy asks, how are you working on guaranteeing the sanctity of the electoral process in November in Connecticut? That's, of course, been a big issue in the news recently, as some states have postponed, delayed, or gone forward. And what's your response to that?
You said that question was from Professor Maisel?
You got it.
No, I figured he'd ask one, so at least it wasn't too hard. I hope you're doing well, Sandy. Yeah, so in Connecticut, it's interesting. Our Constitution makes us one of the 5 most restrictive states in America for absentee ballot and early voting. We don't allow early voting. We only allow absentee ballot voting under very limited circumstances, illness, away from town, military service. And the only way we can ever allow for mail balloting is 2 ways. We have to amend the Constitution, which ain't going to happen by November or before that. Or the Supreme Court of Connecticut says, under this pandemic, you can do it. So we're analyzing strategies about how best to do that. It very well may end up in the Connecticut Supreme Court to decide that, our constitutional provisions, which are very restrictive, versus what you're talking about. So I don't have an answer yet, but our hope is to do it. We pushed back our presidential primary twice. It was supposed to be in April, then it was June, now it's in August. And we may have a few primaries in August for the General Assembly, but we're keeping an eye on it for now. But it's a very difficult question in Connecticut compared to other states because of the Constitution.
So when you talk about reopening maybe in Memorial Day, of course it will be phased. Do you have a sense of what's that going to look like, right? So when we say, okay, restaurants are open again, is it going to be only a limited number that can go in? Or, I have these visions of sci-fi movies or, people, maybe not even sci-fi, us all getting tested before we can go anywhere, having a big, mark on us. What do you think that's going to look like in Connecticut?
I think like in most states, you're going to see, first of all, limited capacity. So start with 50%. I think you'll see masks being worn. I think you'll see 6 feet apart at tables. For those of you who want to sit at the bar, probably not, right away. Maybe it's going to be 6 feet apart. I think outdoor seating will be welcomed. I think the extent that you have that, they're going to encourage you to sit outside. But I also don't think people are going to go back all at once, particularly, people over a certain age or pre-existing conditions. So that's going to be a real challenge. When you talk to the restaurants, they understand that when they reopen, it will not be full capacity. Their biggest fear is trust, is getting customers back and how to do that safely. But they also remind us, look, they have very strict rules now and regulations, right? I mean, restaurants follow a lot of things now. So if there is an industry that is used to public health department, consumer protection, and others putting a lot of requirements on them, it is the restaurant industry.
Right. So a question that I have as well, we have to talk about the Trump administration, just the federal support. What are your thoughts in terms of the leadership there, but also on the support that Connecticut has been given, whether was their federal aid stimulus package enough, or are you getting the right guidance that you need from the federal government right now?
So the governor deals directly. He's on all these calls with the White House. The feedback we get from him is obviously what you hear from other governors. Testing issues, although those seem to be getting resolved more quickly. PPE issues, the production of personal protection equipment for nurses and first responders and others. In terms of the packages, they did some good things. One of the things they did really well early was the unemployment compensation. So in Connecticut, the maximum is $600 per week for unemployment for the highest earner. They've doubled that. So it doesn't matter what your unemployment is. It could be $300 a week or $600, the maximum. You're getting an extra $600 from the federal government, which will run through July. That's a big amount of money to double someone's unemployment. We're looking at 20% unemployment right now in Connecticut. So that has really been something they did early and very well. That money is now just starting to arrive, but it will backfill. So I think that's one thing I give them a lot of credit for. Clearly, the grants to local municipalities in the states is critical. We don't have county government in Connecticut, so that's not a big deal for us. It's the cities and the state, that's it. We used to have county government, we got rid of it about 70 years ago. That's a big challenge. And I hope that the president will work with Congress to get that done. But the argument that, it's blue states and they're not well run, we're spending money like everybody else on responding to a pandemic. And it doesn't have a blue or red state. And so hopefully they will realize that we can't print money as states. We have to have balanced budgets. They have a lot more flexibility, and we hope they utilize it.
What about, I see a question actually from Meredith Allen. So Meredith is a junior economic major. She's active with the Goldfarb Center. So we're thrilled to see her question. You can read it below, but for those that are watching this video, not live and don't see the comments, her question has to do is, has Connecticut's state and local health departments, do they have the adequate resources and capacity? So you talked at the beginning about improved testing, but what are you working on in terms of contact tracing, which of course has become a big topic lately?
We just announced a very exciting partnership with Microsoft. Actually today, we were on a call today talking about it, and we're going to try to do voluntary contract tracing through your phone. Not going to require it. So
fascinating.
I don't want to hear about Big Brother. It's your choice, or big government. And so if you want to log in, you can do that, and we'll utilize that to help the normal contract tracing method, which is training 500 people or 1,000 people to go out and do it in the community. We do have contract tracing already. We have some employees in the Department of Public Health, but they were tracking diseases of yesteryears that very rarely come up. Maybe you get a case of tuberculosis or something like that, and they're tracking that. But they haven't really had to do that in a very long time, fortunately, because of vaccinations. So we're going to rely on a combination of electronics and modern technology, and then also the usual, okay, social worker goes to your house, who'd you talk to, who do you know kind of thing.
Yeah. I want to shift gears a little bit, because when I read your bio, I was fascinated to see that you were co-chair of the Public Health Committee, and you've won a number of awards for your leadership on that, working on issues from mental health to the opioid crisis. So my guess is that you might look at this from some slightly different angles that others don't. And I mean, what are the other public health crises that you see not related to someone getting COVID-19, but related to just this new normal that we're in and the uncertain times we're facing?
Yeah, I would have two responses to that. I also want to say, and I don't know if anyone's from Connecticut on this call, we have great hospitals. So one thing about chairing the Public Health Committee is you have oversight over all the hospitals in Connecticut. We have 25-something hospitals. We have great healthcare systems. We probably, along with other places in New England, are lucky to have that. We've never had to worry about capacity one day during this crisis. Even in Fairfield County, Greenwich Hospital, they've been put to the limits. We've
Yeah.
never had to worry about it. It is special, the healthcare quality we have in Connecticut and frankly, New England. Two things I worry about. One is look at the underlying conditions, particularly in particularly in African Americans. Look at the underlying conditions that are leading towards higher mortality rates, particularly for younger people. You're talking about diabetes, hyper and heart, tension. That all goes back to preventative care, right? That all goes back to things we've been working on in this country for a long time. The single greatest threat to that is insurance. And the problem is, as the federal government has become an unreliable partner and figuring out a way to do that, to have primary insurance, right? It falls to the states. We can't afford that. No state can afford that. Pre-COVID, you couldn't afford it. Post-COVID, you certainly can't. We need predictability out of Washington on healthcare so that we can make sure that everybody can go see a doctor once a year. The other thing about COVID-19 that is interesting is telemedicine and the rise of it. My wife's actually a physician. She's seen a lot of her patients through telemedicine. That was long blocked by insurance companies. So it shows you how quickly we turned that valve on. I don't think we'll ever go back. But that is one area where we could greatly expand access to folks safely who transportation issues, mobility issues with telemedicine.
Yeah. Well, those that are watching, especially Colby students, keep the questions coming. I have sort of like a fun question for you. I don't know if it's fun, but it's more personal, meaning like,
fun for me is UConn basketball. So if you ask about the UConn men or women's team, that I enjoy.
I'm thinking more about, working from home, you have children, you have a dog, you still have these big responsibilities. Like the work doesn't end. And in fact, of course, for your role in this government as a government leader, it's becomes exponentially more. So how are you dealing with that? What are you learning about yourself, or maybe tell us a good dog story?
Well, my wife and I are still happily married, going on 10 years in August, so that hasn't changed.
Congratulations.
The dog sleeps as much as we suspected he did. He's a happy golden doodle when he's sleeping. He does it a lot. And the kids, look, they're young enough that I think for them, I feel really bad for the children, the senior in high school. Our kids are first grade and pre-K 4. So it's not, look, they miss school, but they're not missing those life events that you think about. I think about the seniors in college and folks like that. Those are the ones that, really got an unfortunate situation. And, they'll persevere and they'll tough it out, but we're doing fine in our house.
Yeah. I see a question from Andrew, who's a Colby student, also part of the Goldfarb Center. And he says, with the economic fallout from COVID, is there any plan in Connecticut to renegotiate tax on a state level, or will the filing date continue to be pushed back? I'm sure as a lawyer, you are even more interested in that question than most. What's your response?
I think I heard the question. He was asking, we pushed back our filing date to July 15th to mirror the feds. Was he asking if we'll push that back again?
To negotiate, it says is there a plan in Connecticut to renegotiate tax on a state level, or will the filing date continue to be pushed back? So interpret as you wish.
I will. I think what he means, and if he, or she, I'm not sure if it's a he or she, but I think what they mean is our normal filing date is April 15th, just like the federal government. We push it to July 15th, as did the feds. I don't think we'll push it back again, but we do have the option to do it if need be, because we have a pretty good rainy day fund, which is something I'm very proud of. That took a long time. When I first got elected, it was $0. It's now almost $2.5 billion. We have cash flow to cover shortages of payments, but at some point you have to pay for services, and that is having to do that, right? So it's all really a cash flow issue. Maybe we could give people 30 more days, but probably not much more than that.
Yeah. And another question from Colby faculty you recognize, Patrice Franco.
Yep.
She says, she mentions
no economics for me. That was above my intellect.
Well, it's about marginalization. So I think you can do this. So Patrice's question is that Connecticut is super wealthy, right? One of the wealthier states. And as you mentioned, also smaller, but it does still have significant marginalization issues. So how can we use this opportunity for Connecticut to become a more equitable state post-COVID?
Boy, that's a good question.
Sure is, right?
We're talking about that at the federal level too, right? I mean, it's all about thinking about equality and income equality and taxation policy. I will say this notion of reforming the ability to pay is better done at a federal level than a state by state level. And I'll give you an example. In Connecticut, we have an estate tax. It generates about $100 million a year. But what we see a lot of the time, Florida or South Carolina, where you have no income tax. So what I would say to people who are looking for the inequality scales, when you do it holistically as a country, it's a lot harder to move somewhere else and play the system against one another. Progressive taxation to me is best done at the federal level, not at the state level, because it's easy to avoid.
Yeah.
But we have that debate. Look, we raised the minimum wage in Connecticut to $15 an hour last year. I was proud to. We have done things to take steps in that direction. I'm proud of that.
Yeah, you should be proud of that.
And a high cost of living in Connecticut, I would add too.
Yeah. I see another question from Meredith, and then we're going to have to wrap up in a minute. But Meredith, again, a junior, asks, should states consider reopening less affected areas before heavily affected areas? I mean, even I think it was today, Governor Cuomo talked about this. How do you manage that, especially in a state, that you have, areas that are much more rural, like Maine, than other areas of the state.
Yeah, I mean, we're a small state. That's the one problem. So when you talk about, okay, an area, Windham County, even though we don't have counties, we have counties for COVID-19. Windham County from Hartford is a 40-minute drive. California, right, that's the entire region of the state in many ways. We have 3.5 million people. That's their county. So in Connecticut, we are going to look at that. We are going to look at areas where you've had less. But given how small we are, I think we would be better to have statewide rules and regulation as opposed to trying to say this county or that. It may work well in Maine. I'm sure Presque Isle, Maine is very different than Portland. But in Connecticut, we're too small, I think, for that to really work.
Sure. My brother lives in Los Angeles, and I would say a 40-minute drive could just be like going to the grocery store sometimes, depending on traffic.
I mean, the furthest I could drive is an hour and a half to Greenwich, right, from Hartford. That's as far as I could go. And that, for many people, is in Texas, that's their county, right?
Correct. So I want to end on a question that Meredith also gave me before this, which is about your Colby experience. So, I mean, and this actually ties into a comment that Sandy's making below about you're doing government majors proud. But it's true, you're a Colby alum.
I didn't always do him proud in college, by the way. Okay.
But you're definitely doing Colby proud now, and the Goldfarb Center is about public policy, but it's also very much about leadership. And you're definitely demonstrating, what a leader needs to be in a moment like this. And curious about your Colby experience, whether it's an academic or other experience, but how has it helped you prepare to be in this role and to be a leader, particularly at such a stressful and time and during such a crisis?
Yeah, I mean, look, we had good professors. Sandy, Cal McKenzie, Tony Corrado, Mark Brewer. I think about some of the folks I had. If you're going to advance in anything, whether it's Congress, whether it's the House, in Connecticut state politics, local politics, I think there's two sides to it. One is you got to be good at interacting with people. You have to be able to have relationships and develop those relationships up and convince voters you're worthy of it. But you also got to know what you're talking about. There is such a need for substance when you're talking about something like COVID-19. And when you watch a governor or a legislative leader or a senator or a congressman who knows what they're talking about, it's comforting. And when you see someone who doesn't, it's really discomforting. And that's not a red or blue thing. So these classes may not get you elected because there's a lot more to being elected than knowing what you're talking about. But you're much more effective, I think much more impactful when you can debate policy. In my role as the majority leader, I got to figure out how to run 400 bills in a session. I don't have time to read them all. That's what you have lawyers to do for you. But you got to be dangerous enough to defend it, to fight off amendments, to explain it to the press. And I think that's where a liberal arts education really comes in and helps you. So enjoy those professors, but also get some real world experience, do an internship, do something like that. Balance your academic side with what I call the political side.
Well, that is a beautiful note to end on. Thank you so much for joining us, for speaking with us, and for helping us learn from you. And we wish you the best of luck as you continue to lead during this time. Thank you so much.
Thanks so much. I appreciate it. Thanks.
Good night, everybody.